My name is Albert Owusu Anza. I'm a neonatologist, and I'm also the medical director of the Neonatal Intensive Care Unit. I've been here at Bryan for 10 years. I started my journey here in the United States in Chicago, and the opportunity to actually be part of a team to start a neonatal intensive care unit was the biggest attraction to me. That is what really drew me or brought me here to Lincoln. I had driven here with my sons for 8-9 hours from Chicago through a very terrible storm, and that memory still sticks with me to this day. It's an honor and a great privilege to be working with these tiny babies to provide the support that the babies need with a great team. And it's always so refreshing to be able to see these babies go through what they go through, to see the anxieties on the faces of the parents and the families in the beginning, and at the end to be able to discharge these babies home well and to see the joy that replaces the anxiety of the parents. This is what really gets me going in the NICU.
I'm Michelle Johnson, and I am an associate professor at the College of Health Sciences, and I have been here 15 years, but at the college the last 9. Back in the day, when it was known as Bryan Memorial Hospital, I was a student nurse at Bryan Memorial Hospital School of Nursing. And I had a faculty member from the college one time come up to me and say, I was wondering if you'd be interested in education in your future. Working with the nurses, working with the students, that's what really got me engaged in the teaching aspect and really sparked my interest. I really appreciate the opportunities that are given for personal and professional growth. Personally, there are many times where volunteer opportunities come across my email, and they can be anywhere in the community, helping out a variety of different people. Recently, we have been given opportunities to go to a Bryan movie night, to go to the zoo, to attend a baseball game for the Salt Dogs. It's a way that the administration are saying to the people of Bryan, thank you for the service that you are giving to Bryan Health. And the thanks comes because the people of Bryan are dedicated and committed to giving the service.
My name is Jade Roth. I'm a registered nurse working at Crete, and I have been in the Bryan family for 20 years. I went to nursing school at Bryan, so I got lucky enough to get a job after I graduated. As my kids got older, working the 3 12-hour shifts was great when they were little. As they got older, they get into more activities. We thought it would be better if I got a position that was more Monday through Friday. And my husband actually is the one that said, well, you know, there's a hospital in Crete. So I did a little research, found out it was part of the Bryan family. Because I was able to just do a transfer over there, I got to keep my date of hire, and it worked out great for my family. There are so many things that have happened in the last 20 years. I can think of a lot of different stories. I do remember vividly, I can even remember the name of the patient, the very first time I was responsible for a patient that coded. And the guilt I felt was indescribable. Not that it was my fault, just the fact that I was watching him. And the people there and the people I worked with made that whole situation a lot easier. They were just very supportive all around.
I'm Christie Mook. I've been with Bryan for the last 15 years, and I'm an IT project manager. I started in medical staff services 15 years ago. During that time, I was in my early 20s, and I was looking for something new and challenging. Medical staff services was a perfect fit for that. I was able to enhance the role, change the way that we did different processes, and Bryan was very supportive in helping me to finish my bachelor's and my master's. I absolutely love that Bryan is always willing to try new things and do something different. So I really enjoy being part of putting new things into place that will make an impact on our end users. Right now I'm working on our EPIC project. All of our systems will allow for better communication. so patients won't be asked the same question over and over and over again as they come through our doors. And it will be easier for our nurses to look up that information. It will be easier for physicians to get results in their office. And we'll be able to provide better care and have better metrics on how our patients are actually improving.
My name is Noreen Aymond. I'm a registered nurse. After 55 years, I go both to East and West as a sexual assault nurse examiner. When I started at Bryan in 1962, I had been a clinical instructor in Grand Island after graduating from my home hospital, and so I chose to work in surgery here. In November, the hospital called me and offered me a position as a blood bank nurse. And when I wasn't busy with that, I did student health physicals and employee physicals and learned the emergency department, for which I stayed. I also remember a very traumatic experience for me in 1965 when the ride went down at the state fair and I was the only nurse on in the emergency room as a very young woman. I believe there were 48 people hurt, 2 passed away. The ambulances came unannounced. There were very few people in the hospital that day because it was a Labor Day weekend and a lot of people were off. It was a real learning experience. It's been a great ride.
I'm Lisa Vale, Vice President of Patient Care Services and Chief Nursing Officer, and I've been with Bryan 5 years. This year I celebrated my 36th year as being a registered nurse, and when my youngest child went off to college, we were at a point in our lives where I was able to look at some new opportunities. So after about 19 years in the Kansas City market, I was lucky enough to find Bryan and connected right away with the mission and the people that were here, and I am honored to be a part of this team. I think over the last 5 years, the thing that I remember the most is really when we experienced the significant census increase with the local market changing. And I really saw every single member of our team step up and give it everything that they had for us to be successful to meet the needs of our community. I was so proud of what we have been able to accomplish through that experience and what we've continued to be able to do with those sustained volumes. It really is a one team, one purpose effort, and it's a great place to be.